Good evening, Mr. Four.
Good evening.
I am your student nurse, Miss Four. I'm here to assist the doctor. We're going to start with a skin assessment, nail assessment, hair assessment, and lymph node assessment.
Okay.
I'm going to ask you to take your shirt off so I can see your skin real well.
Okay.
And check to make sure everything's even.
I've got a few scars and stuff, so
Okay.
I'm sure I'm going to have some fun things for you to look at.
Okay. Well, I'm just going to do a complete overview and just look at everything, make sure everything looks equal.
Okay.
So it all looks pretty even. The coloring looks pretty even, except for I can see a scar here. I see a nice scar here. Are there any other scars that I need to be aware of?
I've got one here for arthroscopic surgery. I've got one here from some stitches. Let me see here. There should be. Let's see the one here. There should be a couple on the back of the shoulder here as well.
Okay.
I think that's it.
I noticed that you have a nice tan going on. Do you wear sunscreen while you're outside?
As much as possible.
Okay.
Of course, it's quite the farmer stand going on, so a little too Caucasian in other places.
Okay. I'm just going to continue looking over, make sure we have nice uniformity of skin. It's all even, nice and smooth. Okay. Have you relax your hands up and do a nice little pinch. We're just checking the turgor, and it should just relax back down, which it's doing. That just shows us that your skin has elasticity and it's hydrated. So you're doing a good job keeping yourself hydrated. So we're looking for some thickness. Make sure your skin's the same thickness everywhere. As you get older, you're going to lose some of the fat levels of your skin, and it'll start to thin out, and the skin will tear easier.
Oh, okay. That's not good.
So, but it's normal.
What do I do? Eat more cheeseburgers?
No, nothing. Normal process of aging.
Oh, no way to counteract that?
Not really, no.
Oh, okay.
So that's why as you get older, you get colder.
Okay. I don't, but
So you do a good job of keeping your skin clean, bathed, all that, because I don't smell anything funky. So
yeah, I work outside a lot on a motorcycle range, so I'm pretty sweaty. So I got to come in and take a shower when I get home. So
okay. All right. So let's see. I'm gonna start by measuring the nice little scar you have here. So it starts about here and ends about there. You see exactly how long it is. We got 2 inches, which is about 5 centimeters. Okay. Let's see. You said you have scars over here?
yes, ma'am. Should be one on the side, couple in the back, and I think one in the front here. They were arthroscopic.
Okay, I can see little teeny marks right here. Yep. So that's a 2 centimeter and a 1 centimeter mark there. Let's see your smallpox shot. Don't see any other real discoloration from, unless they went in right by your smallpox scar,
Maybe.
where the other scar is.
I'd forgotten all about that.
So, and if that, I mean, that'd be very, they could have gone in real close there and would be able to tell the difference.
Okay.
So, I know you have lots of little freckles or moles. Anything different about any of them? Any new ones?
Nope. Got one right here.
Okay. Okay,
That's
good.
it. There it is. Good.
Gotta fight through all the hair to see it. That one's about 1.5 centimeters. So 1.5 centimeters. 5 centimeters left wrist. 2 centimeters. Left shoulder. Distal. And 1.5 centimeter proximal shoulder. Okay, I'm gonna have you
Lay down so you measure
lay
this one.
down so I can measure that one.
There's the one over here too. So
Okay. Let's see, we're gonna mark that one there and there, so I can get a good measurement. Start there and go there. It's about 17 centimeters on the right leg. Oh, let's see here.
Maybe the time was just by it there a second ago.
Yeah, I just want to find a good spot to mark it here. Right there we go. See, on the distal side we got 1 centimeter. Oh, there's a nice tan again. Having a hard time finding something. There's a little one right there. About 8 millimeters on the proximal side. Okay, and then you have this nice little scab here, so we'll measure that one too. Has that scab been there long?
Not that I'm aware of, but then I wear long pants most of the time anyway, so.
Are you out near the woods at all?
Sometimes.
Do you check regularly for ticks?
Oh, I mean, yeah, I mean, now the tick season's starting to come again, yeah.
Any tick bites recently?
Not that I'm aware of, I found any.
6 millimeters by 3 millimeters. Okay. Alright, go ahead and sit back up again. Just check your pulses real quick. Alright, I'll let you go ahead and sit back up.
Okay.
Okay. Sound good there. Alright, you can check your hairline here. Any notice any difference in the hair?
This one great.
Isn't great. Any growth difference?
Nope.
All grows pretty evenly?
Yep.
Alright, I'm going to check your nail beds. You check, make sure you want to press down on it. When it comes back, you want to be able to count to 3 and have it back to its normal color by then. That makes you say you have good blood flow. Other one we're going to check is for the angle of your nail bed. Should be a 160-degree angle. So when you lay it like that, you should be able to see about a 160-degree angle there. And that's normal. The other way to check if you don't have a ruler is hold your thumbs together and you should be able to see a diamond in the center. And that's normal. When it gets, yep, just like that, it shows a diamond. If it gets to be where it's not a diamond, you want to have that checked out because then your fingers and nails are growing wrong.
Okay.
Okay. I'm going to check your toes. Just checking for the thickness of the toenails again. Okay, and those look good also. So, okay, nail look good. I'm just going to check and see how smooth the nails are. Do your nails split at all when you cut them?
When I cut them, no.
Okay. You don't notice any breakages in them?
Mm-mm. Just when they get a little too long and I catch them on something.
Okay, yeah, that's normal. Okay. You notice any fungus growing on them where they turn black or yellow?
No.
Okay. Okay. Well, those all look good. So I'm going to start checking the lymph nodes. You
Okay.
got lymph nodes all throughout your body. I'm going to check with the back of the head first.
Okay.
So I'm going to have you actually turn towards me a little bit. And then just bring your head down some. I'm going to start back here in the center. You have lymph nodes maybe about 0.5 millimeter. Like little peas, they move around when we rub. Let me know if you feel any tenderness or soreness when I hit them. And they may move when I rub on them. And I'll probably go over some of the areas twice, soft the first time and then hard the second time. Just in case they move the first time and then a little bit more pressure the second time. Thank you, sir. Any pain or tenderness back in here?
Nope.
These are all feeling normal, nice and soft. They move around easily, which is a good thing. Okay, I'll have you look back up. you bring your left hand and put it on top of your head for me.
Okay. There's a few skid tabs underneath there, so
Oh,
be
okay.
careful.
I'll come back and measure those then. Are they new? Have they always been there?
They've been there for a while.
Now your lymph nodes will go down into the side of your arm here. So if you ever have any increased tenderness down through here. And these two are all feeling normal. And you got the lymph nodes out and through here also. Now keep an eye on the skin tags. Make sure they don't get any bigger. Make sure they don't change colors.
Okay. Other side?
I put this out. And with all these wonderful little moles and freckles you have you noticed a change in any of those recently?
Nope.
No. I'd watch for those because there's 4 things we look for those as if they change. Called the ABCD rule. If they become asymmetrical, to watch for that. If their borders change, because they want the borders to stay the same. The color, if the color of them changes at all. Or D, the diameter. You don't want them being any bigger than the size of a pencil eraser.
Pencil eraser?
Yep.
Okay.
And these all are nice and soft. They move around well. Okay, now you bring your arm down and just relax it on line. You've got lymph nodes that hide in here. So again, if your arm for some reason all of a sudden gets real tender or sore and you can't figure out why, you may want to have somebody just gently rub and see if the lymph nodes feel funny.
Okay.
Thank you. There we go. Because they should be like little keys moving around in there. And the last set of lymph nodes I need to look at are in your groin, so I'm going to have you lay down for me.
Okay.
I'm going to take your left knee first and bend it slightly out so it's coming out this way. There you go. That's good right there. Okay. And again, any pain or tenderness as I'm doing this? No, sir. Okay. And these are all nice and tender also. Okay, and I'm going to switch legs.
Okay.
And this one out.
All right. This one's mechanical, so.
Just take your time, that's fine. And these are also all nice and soft. They move around nicely. Okay. And then have you sit back up.
Okay.
And since I found those skin tags, I'm going to measure some of those skin tags.
Okay.
So I'm going to put this arm up first. Yep, on my centimeter side here. So, let's see, there's one. That one's 3 millimeters. That one's 3 millimeters. That one's 5 millimeters. And that one's 3 millimeters. So you have 4 skin tags on this side. And they range from 3 to 5 millimeters. And they're all skin color, so that's good. Do the same over here. Let's see. 4 millimeters. This one flat. 5 millimeters. This one here's a little bit longer than the rest of them. And he comes in at 6 millimeters. So keep an eye on that one because he is a little bit darker, but he looks good right now.
Okay.
So there's 3 on the.
Should have mentioned that to the doc when he comes in, or?
It wouldn't hurt to tell him, but it's still within this normal size range
Okay.
at this point. So thank you for your assistance, and I'll let the doctor know that you're ready to see
Okay,
him.
can I put my shirt back on?
You can put your shirt on for now.
Thanks.